All right, ready to dive into a topic we all probably think about at some point, right? Blood tests.
Hmm.
Whether you're like prepping for one soon or just kind of curious about this whole medical procedure thing, um, this deep dive is for you.
Absolutely.
We've got some insights from the UK's National Health Service, the NHS,
Okay.
Australia's clinical labs, and Healthline over here in the US. So kind of a global perspective on this.
Oh, cool. Sounds good.
Yeah, and it's interesting how blood tests are just so routine,
Right.
but I feel like there's a lot going on behind the scenes.
Yeah, there's a lot that people don't realize about them, for sure.
Exactly.
Yeah.
So, like, why are they even done? I get that my doctor orders them,
Yeah.
but what's like the big picture reason for these things?
Well, they're done for like four main reasons.
Okay.
The first is that they give a snapshot of your overall health. You know, helps catch potential issues early on.
Yeah.
It's kind of like a checkup for your insides, even when you're feeling fine.
So not just when I'm sick.
Exactly, yeah. Not just to figure out why you're sick. It's just kind of a general, like, how are things going in there?
Gotcha, gotcha.
The second reason is that they help diagnose what's causing symptoms.
Okay.
Like if you have an infection or a nutritional deficiency or something.
Mhm.
It's like, your doctor's playing detective with your blood.
Makes sense. So what else?
Third, blood tests can assess your risk for certain conditions.
Okay.
Some tests can spot like genetic predispositions or early signs of things like diabetes or heart disease,
Oh, wow.
which is huge for prevention.
Yeah, that's really interesting. So it's not just what's happening now,
Right.
but what could happen, like, way down the line.
Exactly.
So it's like future health, too.
Yeah. And finally, blood tests are really important for managing existing conditions.
Mm-hmm.
They track how well treatments are working.
Okay.
And so doctors can make adjustments as needed. Like someone with diabetes, regular blood sugar monitoring is essential.
Yeah, for sure.
Yeah.
So we kind of get the why now.
Right.
But what about the actual experience?
Okay.
The NHS mentioned a finger prick test,
Mm-hmm.
which sounds pretty simple.
Yeah, some tests, like for blood sugar, can be that easy. But most involve taking blood from a vein in your arm with a needle.
Okay, yeah, that's the one I'm familiar with.
Yeah.
And needles, I know, they make a lot of people nervous.
Oh, yeah.
Actually, clinical labs in Australia had some great tips for dealing with that.
Oh, cool. What did they say?
Well, they suggested focusing on your breathing, maybe picturing like a relaxing scene,
Okay.
or even just talking about your pets can kind of distract you and ease the anxiety.
Oh, the pet one's a good idea.
Yeah, I bet that works wonders.
Anything to get your mind off of the needle, right?
Yeah, for sure. And even though it's usually really quick,
Mhm.
there might be some bruising or swelling afterwards.
Right. It is still a needle going into your arm.
Exactly.
Mm.
Speaking of things that might make you uneasy,
Okay.
did you know some blood tests actually require you to fast?
Oh, yeah, that's an important one. Fasting is super crucial for accuracy because food and drink can change things in your blood and really make the results unreliable.
So like if I just had like a giant milkshake, that would mess it up.
Yeah, exactly. Things like that, especially for tests like blood glucose or liver function, iron levels, those often need fasting.
Okay, so how long are we talking here?
Well, Healthline had some details on that.
Okay.
Most tests need about 8 to 12 hours without any food or drink, except for water, of course,
Oh, okay.
which seems long, but it's really important to follow those instructions from your doctor.
This is where I think it gets tricky for people.
Yeah.
Can you have like coffee while you're fasting?
Oh, that's a good question. I feel like everyone wants to know that one.
Yeah,
Unfortunately, no.
really.
Even black coffee has caffeine and other compounds that can, throw off the results.
Bummer. Okay, so coffee's out. What about water?
Water is totally fine.
Okay, good.
Staying hydrated is important.
Mm.
It actually makes it easier to find a vein for the blood draw.
Okay, good to know.
And it's just good for you in general.
Exactly. Healthline mentioned some other kind of surprising things that you should avoid before a blood test.
Oh, really? Like what?
Well, even sugar-free gum can affect the results.
Really?
Apparently, chewing releases compounds that can interfere with the measurements,
Yeah.
and smoking is a no-go too because nicotine stays in your bloodstream for quite a while.
I didn't know that about the gum.
Yeah, it's surprising.
Wow, that's good to know.
And even strenuous exercise is something you should avoid before a blood test.
Oh, wow.
Rest is best, apparently, for accurate results.
No last-minute gym trips.
Exactly. And then, of course, certain medications can also interfere. So always talk to your doctor about any you're taking.
Right.
They might need to be adjusted before the test.
Yeah, for sure.
So this kind of highlights how important it is to be open with your doctor,
Absolutely.
even about things that might seem small or silly.
You never know what might affect those tests.
Exactly. Honesty is crucial, for accurate results
Right.
and getting the right care.
Yeah.
Now let's talk about kids and pregnancy for a sec.
Okay.
Healthline had some tips for parents, if their children have to fast for a blood test.
Oh, yeah, that can be tough. Little kids and fasting don't always go hand in hand.
Right. Well, apparently scheduling the test early in the day helps minimize that fasting time.
Oh, that's a good tip.
And then, of course, distractions, like cartoons or games.
Oh, yeah, gotta keep them occupied.
Exactly. Exactly. And then, of course, having a treat ready afterward is always a good idea.
A little reward.
Yeah. Now, what about pregnant women?
Okay.
Any, special considerations there?
It seems like fasting's generally safe during a healthy pregnancy,
Okay.
but always, consult your doctor for personalized advice.
Always best to check.
Mm-hmm. Welcome back to our deep dive into blood tests.
Okay.
We've covered the reasons behind them, what to expect, the fasting thing.
Yeah, all the important prep stuff.
And now let's kind of explore what happens after the blood test.
Okay, so needles out, bandages on, what next?
Right.
I think people always want to know how long it takes to actually get those results back.
That's a really common question.
Yeah.
And it really depends. The turnaround time varies based on how complex the test is,
Okay.
the lab's workload, and even your doctor's procedures.
So it could be like days, weeks even, just kind of a waiting game.
Yeah, pretty much. But the NHS had a good tip, though. If you haven't heard back after a few weeks, just reach out to your doctor or the lab directly.
Oh, that's a good point.
It's always better to be proactive.
Yeah, just get on it.
Uh-huh.
While we're waiting, are there any red flags we should watch for, signs that something might be wrong?
I mean, most blood tests are pretty routine and they don't reveal any major issues.
Okay.
But if you experience anything unusual after the test, like excessive bleeding, dizziness, fever, contact your doctor right away. Better to be safe than sorry.
Right. Definitely always good to err on the side of caution with that stuff.
Yeah.
Okay, so the results come in. Now what? I know those reports can be kind of intimidating, all the numbers and medical jargon and everything.
Oh, yeah, they can be really confusing. And that's where your doctor really comes in. They'll explain the results in detail, put everything in context, based on your health history and whatever concerns you have. So don't be afraid to ask questions. Make sure you really understand everything fully.
Yeah, it's so important to be your own advocate in healthcare.
Absolutely.
Now, I'm curious about the bigger picture, like the future of blood testing. Are there any cool developments on the horizon?
Ooh, that's where things get really exciting. The field is constantly evolving. Researchers are developing tests that can detect diseases even earlier,
Wow.
monitor treatment responses more effectively,
Mm-hmm.
and even personalize healthcare based on your unique genetic makeup.
That's incredible. It's mind-blowing how far we've come from those early bloodletting practices.
Oh yeah, it's remarkable progress. One really interesting area is the development of non-invasive blood tests,
Okay.
which would get rid of needles altogether.
Oh, wow.
Imagine getting all the information you need from a saliva sample or a quick fingertip scan.
That would be a game changer.
Right, but especially for people with needle phobia.
Yeah, for sure.
And it would make blood testing more accessible for people in remote areas or with limited access to healthcare.
Oh, that makes sense.
Yeah.
So what are some of the specific technologies that are being developed for those non-invasive tests?
Well, one promising area is using light-based sensors to analyze the composition of your blood through your skin.
Really?
Researchers are also exploring ways to detect disease biomarkers in exhaled breath
Okay.
or even tears.
Tears.
Seriously.
Yeah, it sounds kind of like science fiction, but it's becoming a reality.
It's amazing.
And these technologies could totally revolutionize how we diagnose and monitor health conditions.
It's wild.
It is. All this stuff is so fascinating. It's inspiring to see how science is just constantly pushing the boundaries of what's possible.
Right.
But with all these advancements, there's ethical considerations too, right?
Oh, absolutely. As we delve deeper into personalized medicine, genetic testing, all that,
Yeah.
we have to consider questions about privacy, data security, and access to these technologies.
Yeah, it's like opening up this whole new world, but it comes with its own set of challenges.
Exactly. And it's a conversation we really need to be having as a society.
For sure.
It's crucial to make sure these really powerful technologies are used responsibly and ethically.
Yeah, for the benefit of all.
Exactly.
Okay, so we've gone from needle anxiety to the mind-blowing future of blood testing.
Right.
I'm feeling a lot more informed and honestly kind of excited about all these possibilities.
too.
What else can you tell us about the different types of blood tests out there and what they can like reveal about our health? All right, welcome back to our final part of this deep dive into blood tests. We've covered like why they're done, what to expect, even peeked into the future.
Right.
But now I think we should really unravel the different types of blood tests and what they can, tell us about our health because there's just so many.
Yeah, the sheer variety is really incredible. It's pretty amazing.
Yeah, it really is. It's like a whole world inside us that we don't even really think about.
Mm-hmm.
So where do we even start? How do we categorize all these different tests?
Well, one way to think about it is by their purpose.
Okay.
Some tests, they target really specific organs or systems, while others give you a broader overview of your health.
Okay, so it's like big picture versus like zoomed in.
Exactly.
Okay, I like that. So what kind of things can we actually learn from these tests?
Well, let's start with some of the common ones.
Okay.
The complete blood count, the CBC.
Okay.
It's a fundamental test that measures the various parts of your blood. Red blood cells, white blood cells, platelets. And this one test can help detect a really wide range of conditions, from anemia to infections.
So that's like a basic blood checkup.
Yeah, pretty much. It's kind of like a checkup for your blood itself.
Okay, that makes sense. What else?
Another common one is the Basic Metabolic Panel, or BMP, which assesses your kidney function, electrolyte balance, and blood sugar levels.
Okay.
All important indicators of your metabolic health.
We touched on like metabolic health earlier. Can you maybe explain that a little bit more?
Yeah, sure. So your metabolism is basically how your body turns food into energy, right?
Okay. Yeah.
And any imbalances there can lead to various health problems. And this BMP, it can give clues about those imbalances.
So it's not just about individual numbers, but how they relate to each other.
Exactly. Like high blood sugar could point to diabetes, while abnormal electrolytes might signal dehydration or kidney issues. So the BMP helps connect those dots.
Okay, that's really helpful. So we've got the CBC, BMP, those are kind of for overall health.
Right.
But what about tests for specific things?
Yeah.
Like specific organs or systems?
Yeah, there are tons of those.
Okay.
For example, there's liver function tests.
Okay.
They can detect liver damage or disease.
Oh, wow.
They measure levels of certain enzymes and proteins that your liver makes.
Okay.
So basically giving us a peek into how healthy your liver is.
So if you were like worried about your liver health specifically, that's the test to get.
Yeah, exactly. And then there are tests for thyroid function,
Okay.
which can spot problems with your thyroid gland, which is super important for your endocrine system.
Right.
The thyroid makes hormones that regulate metabolism, growth, all kinds of stuff.
So if it's out of whack, it can cause like a lot of different problems.
Yeah, exactly. Hormones are really powerful. And then, of course, you've got your cholesterol tests.
Right. Everyone's always talking about those.
Yeah, which they assess your risk for heart disease.
Okay.
They measure different types of cholesterol in your blood, and that can help identify any potential cardiovascular risks.
It seems like there really is a blood test for everything. But with all these different tests and results, it can get pretty overwhelming, right? How should listeners approach like understanding their blood work? It can feel intimidating, I think, for a lot of people.
Yeah, you're absolutely right. It can be a lot of information, but the most important thing is talk to your doctor. They're your best resource for really interpreting those results.
Yep.
Ask them to explain what the numbers mean and how they connect to your overall health.
Okay, good advice.
Yeah, remember, knowledge is power, especially when it comes to your health. And blood tests, they give you that valuable information that can really help you make good decisions about your health care.
Absolutely. And as we learned earlier, this whole field of blood testing is just constantly evolving, so there's always going to be more to discover.
Always something new, yeah.
So this deep dive has been really eye-opening. I feel like I've learned so much, and I have like a new appreciation for blood tests, for sure.
That's great to hear. Remember, blood tests are a fantastic tool for understanding your health. And by staying informed and engaged in your healthcare, you can really make the best decisions for your well-being.
Absolutely. So there you have it, folks. We went from the basics of like what even is a blood test to exploring this whole vast world of different types and what we can learn from them. And, even though our deep dive ends here, Your journey of learning and discovery continues.
All right.
So stay curious, ask questions, and really take an active role in your own health journey.
Absolutely.
Until next time.